Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Crissy Piper, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this. What's up, my fellow Suburban Warriors? I hope that you are as eager and excited for today's guest as I am. I don't know if it's because I am a 46-year-old perimenopausal woman or just because I love all of her TikToks, but I'm literally bursting at the seams to get this conversation started today. Today, my guest is OB-GYN, founder of the Galveston Diet, Dr. Mary Claire Haver. Dr. Mary Claire Haver is a wife, mom, physician, and entrepreneur who has devoted her adult life to women's health. As a board-certified OB-GYN in the Houston area, Dr. Haver has delivered thousands of babies, completed thousands of well women exams, counseled patients, taught residents, and did everything an academic professor and OB-GYN could do. Her patient population aged. Dr. Haver was overwhelmed with the number of complaints and concerns her patients had with weight gain while going through menopause. For years, she told her patients to eat less and exercise more. But it wasn't until she too experienced the changes of menopause and midlife weight gain that she realized this advice doesn't work and ultimately led to her creating and developing a new program, the Galveston Diet. The Galveston Diet is the first and only nutrition program in the world created by a female OB-GYN designed for women in menopause. The Galveston Diet helps women reach their health and wellness goals through an anti-inflammatory approach to nutrition. Dr. Haver believes in the power of nutrition to combat inflammation and highly recommends the unlimited benefits of intermittent fasting. As part of her ongoing research, she became certified in culinary medicine in 2019, which specializes in medical nutrition. She has also been coined the menopausal guru on social media because she is out there speaking authentically about the journey that all of us women go through. So I am so excited to welcome you to the podcast.
Thanks for having me.
Absolutely. Now, for those of you that have been listening to the Suburban Warrior podcast, you probably recognize her name because she did appear on episode 4 of the Suburban Warrior podcast. And we got into all things Galveston Diet. We talked at length about intermittent fasting, about nutrition. And I'm really excited to have you back on the podcast again because one podcast is not enough with you. There is just so much information that you have and that you really constantly share on your social media platforms all the time. But, you know, like I said, maybe it's because for me specifically, you know, being in perimenopause for the last several years, you know, the journey and the body changes that we go through and the fact that no one's really talking about it, I am just like sucked in to all of the information that you have to share. So first, I want to thank you for being a voice for everyone and being out there and talking about it really in an authentic way, because these are things that we're all experiencing.
Exactly. You know, when I began my social media journey, I wanted to just share information about nutrition and, you know, how we are underutilizing nutrition for all things. You know, in Western medicine, we just give Band-Aids out to fix problems. And I really wanted to focus more on prevention. Well, I was doing pretty well in social media channels, but I let my content be guided by my followers and what they want to know. And I kept getting repetitive questions about what is perimenopause? How do we define perimenopause? How do I know? I went to my doctor. He said I'm too young. I mean, tens of thousands of comments. And so a lot of my content has been directed to include just more information and answer questions about perimenopause, how old, what are the symptoms, what to ask your doctor. And it's led me to develop tools so that patients can be more informed with their own physicians. So I thought, we don't have a good blood test for determining if someone's in perimenopause. There is not a blood test that can tell you that. There are people who are claiming that. However, it's not recognized by like the American Board of OB-GYN. The way a physician would diagnose that you're in perimenopause is a combination of your age, your symptoms, and ruling out other causes like hypothyroidism, et cetera, because the symptoms of perimenopause can present in other disease states. So I found a scoring system that was the Australasian Menopause Society created. And it was originally created to help gauge if someone's symptoms were being improved with hormone replacement therapy. But then they realized it was a good way to gauge if this constellation of symptoms that you're having could actually be from perimenopause. And so I thought, wow, no one ever taught me about this. Again, I've been out of training for 20 something years. And I said, this is fascinating. So I created a quiz and dumped it on my website. And then it leads to an email string that just basically bombards you with education and information about your own perimenopause and menopause and things that you can discuss with your physician. I talk about medication options, nutrition options, how we can combat things, where intermittent fasting may play a part in this. And I can't believe how many people have taken this quiz. It just blows my mind. So, I just am shocked by the responses I get back from followers on what their healthcare providers are telling them. They are being dismissed. Ageism comes into play. Their symptoms are minimized. They're told to suck it up. People are telling them they don't believe in treating this with anything. Hormones may not be an option for everyone. And really, what we talked about a little bit offline is that because women are so starved for education and information, because there is such a need, and because the OB-GYN training is so minimalistic when it comes to perimenopause and menopause. I mean, I say this as a former OB-GYN program director. I was in charge of making sure that all the boxes were checked for our, 30-something residents in our residency program. And we did thousands of hours of training in obstetrics, very important, in GYN oncology for ovarian, uterine, cervical cancer, in adolescent gynecology, in surgery and surgical techniques. But when you broke down the nitty gritty of menopause, how to treat it, how to nuance it, perimenopause, it was maybe 1% of our training. And I'm not exaggerating.
Yeah.
And when I think about it now that I'm a menopausal woman, wait a minute, more women will go through perimenopause and menopause than have children. 100% of women will go through this if they live long enough. 100%. So, your healthcare provider more than likely is clueless and doesn't have a lot to offer you because they weren't taught. And one of my fights is going up to the board and saying, we've got to do better. I'm constantly calling them out. I mean, I actually did a TikTok that got a lot of views. That was specifically looking at the articles we're required to read this year to maintain our board certification. I do this every year. I'm so proud of my board certification. I worked hard for it. There's so much great information in there, but there was not one single article mention anything specific to perimenopause or menopause. Not one. This year, in the 50-something articles they put out for us to maintain our licensure, our board certification. Right. Nothing. I said, this is a problem. So I feel like a little one-man band. The other thing,
I feel like you are too. Because having the experience of going to my, OB-GYN, who I've seen forever through having all of my children and who, surgeon, C-sections, everything. I mean, I've known her for 20 years. And, when I'm having all these symptoms, it's like, oh, okay, well, welcome to menopause. And like, there's not really much to do about it. Just to your point. I don't think she said the word suck it up, but that was basically what I got. And everything that I am doing and treating, we'll get into maybe some of the other symptoms that women experience. It's just all through me just doing research. And, obviously, I've known you prior to seeing you on TikTok. So I know how reputable you are. I know you're a physician. So I take your advice because I know that it's coming from a reputable source, but there's a ton of sources out there that aren't, reputable. So, you started this whole journey because of one of the most common symptoms of menopause, which, I have a lot of friends, family that complain about, is weight gain.
Right.
And so you created this the Galveston Diet, which has had huge success around weight gain because it's really like a wellness program.
Right.
And it involves intermittent fasting and, an anti-inflammatory diet. Tell us a little bit about that.
So, we know from science that women do gain weight throughout their lives. And we see it especially in perimenopause and menopause. The special thing about this weight gain is we see a shift in our body composition from, not for everyone, but for most, where you used to develop fat deposition about the hips and thighs, the classical pear shape, which is very much in style right now, not when I was 20, but
yeah. That's so true.
Is to the apple shape, where we start having visceral fat deposition around our organs. And this is driven by several factors, by age, just the aging process does it, our increasing inflammation levels associated with perimenopause and aging, and also the increasing activity of our androgens, including testosterone. So, the combination of those three start leading to, we gain weight, yes, but we start seeing an increasing amount of visceral fat versus subcutaneous fat, which is where we always used to gain weight under the skin. There's nothing inherently dangerous about subcutaneous fat unless you have a lot of it and it puts wear and tear on your joints. Visceral fat is a different animal. It is an inflammatory organ. It creates cytokines. And it in and of itself being there, it's like a toxic person. It just creates more drama,
Oh my gosh.
So it continues this, I describe it as a hamster wheel that's just spinning faster and faster. And everything in our society, our obesogenic society, in our lives, in our overscheduling, in our stress levels, in our aging, in our menopause, is increasing this inflammation, which is driving more fat to the abdomen. So what can we do to, and that is kind of the crux of the Galveston Diet, is not only are you losing weight, you are losing fat. You don't want to ever sacrifice your muscle for weight loss. And you are losing visceral fat. We've got to drive that number down because that visceral fat is linked to heart disease, diabetes, stroke. And you're only 46. I'm 53, so I feel like an elder sister here. For me, it's not so much. And for most of our students and then the patients who come to see me, I'm like, what do you want? What is your goal? What can I help you with? And no one's talking about getting in a bikini. They don't care about it. They're like, I want to feel better.
Yeah.
I want my life back. And I want to be able to play with my grandkids if I ever have any,
Yeah, sure.
Like, they don't want the health issues their parents have, their aunts and uncles have, their grandparents. They are looking at that and realizing where they are in the road and what can I do to not have that life, to not suffer those diseases. And I said, well, there's no guarantees, but nutrition can go so much further than you realize. So let's start breaking that down.
Yeah. Yeah. It's amazing. And just like all the factors, including the intermittent fasting. I know, I think it was prior to the podcast, but then after the podcast, I really started it and I've been doing it for years and it's made an enormous change in my body and not just my weight. And I know there are so many benefits of intermittent fasting, but I think it's just like everything else. Like, what you do every day matters. So doing it every day and sticking to it as part of your lifestyle is really where you see the changes. Because I think where some people might struggle with intermittent fasting, and you probably know this better than I do, is they try it for like a couple weeks. And then, if they're not like being completely a new person, they're like, forget it. I'm going to go back to where I, doing whatever I want. But I think it's just being able to stick to it.
And they don't ease into it. They like wake up like, today I'm going to fast 16 hours. I'm like, no, you have got, give yourself I say it's a 6-week process to let your body acclimate to get the benefits. And if you do it the way we teach you at the Galveston Diet, it's so much easier. It's so much easier to stick to, and it will literally be like breathing and you won't even think about it. A natural, normal.
I agree. I am one of those people that was like, I could never, ever not eat until 11 o'clock. I have breakfast. I have, vanilla creamer in my coffee. I can't give that up, right? All the stories that we continue to tell ourselves that make us think that we can or can't do something. I was telling myself that, but it wasn't until I really gave it a try and stuck to it that I was like, now I can't even imagine pouring creamer in my coffee in the morning. It's been years, and I actually enjoy my black coffee now, Okay. So besides weight gain, because you're still a practicing physician, what are some of the other, I would say, most complained about factors or symptoms of menopause?
Yeah. There are, of course, hot flashes. I mean, that is about 85% of women will seek something from their physician for the hot flashes. And not only with that, the hot flashes disrupt your sleep. And so when you're not sleeping, nothing works. So when a patient comes to me and we are like breaking down their symptoms and kind of, what a treatment plan is, I'm like, the first thing we need to do is you need to sleep. And if the hot flashes are waking you up, we need to fix that. And then we start going through the options. We start with nutrition. We talk about over-the-counter things. And then we launch into medications, hormonal, non-hormonal, and see kind of what their personal goals are. What I don't love is if any of your listeners out there go and it's a cookie cutter situation where everybody gets this pill, this shot, this pellet, this whatever, and no one sits down and teases out your individual symptoms, what your personal goals are. This is not a one size fits all treatment for anybody. 100% of us will go through perimenopause, but it is a very individualistic process based on genetics, lifestyle, environment. We're all built differently, and there's at least 40 symptoms of menopause. So hot flashes, that's a dead ringer. That's easy. Very few things cause this kind of hot flashes other than that, but worsening mental health. Okay. Yeah. That's a huge
I think that's a big one that a lot of people don't talk about.
New onset, either you had a history and it was fairly well controlled and all of a sudden it's out of control. That's what cardiovascular issues, palpitations, the SA node, which is kind of like the thermostat in your heart that controls your heart rate, has estrogen receptors on it. And so for some women, they can have new onset of palpitations. People are tachycardia. People ask me this all the time. And I'm like, yes, cardiologists don't even know this or haven't kept up with the latest literature. Worsening autoimmune disease, all of it, lupus, thyroid, any kind of autoimmune disease can and will get worse. And those who have had active autoimmune disease in pregnancy know this. Your estrogen levels surge in pregnancy, and a lot of autoimmune diseases get better. They have this beautiful pregnancy. They're amazing. And when those estrogen levels decline postpartum, here comes the autoimmune disease back with a vengeance. Estrogen is a powerful anti-inflammatory hormone. And so autoimmune diseases, just especially arthritic ones, we see, and just aches and pains, muscle joint, I can't walk, I can't this. I actually just diagnosed lupus in a patient who was thinking, because she saw one of my TikToks, she came to see me, that on her new onset of aches and pains, like she got out of bed and she had this horrible early morning stiffness and like couldn't even walk. Her feet hurt so much. And like little flags are going off in my head. I'm like, I'm not saying menopause isn't a part of this, but this sounds like autoimmune arthritis. And just sure enough, did the labs and she turned, and she's off to go see her rheumatologist now. So, a lot of diseases you can have crossover, and you really have
so interconnected.
Yes, you have to be an acute clinician to make sure, we make the diagnosis of perimenopause symptoms. You can give the patient the quiz. My quiz's online. You can go take it at, I have a couple of websites at galvestondiet.com. You can absolutely take the quiz there and, go to your doctor and say, this could be perimenopause. Another thing is, the age. So the average age of menopause is just a day in your life. One day in your life is defined as menopause. It is 1 year after your last menstrual period, if you still have them. Okay. That's the day you're in menopause. That's clinically, it's defined that way. Now we can confirm it with a blood test and whatever. We're great at diagnosing menopause, terrible at perimenopause because we fluctuate so much. So the average age of menopause is 51 in the US, but 45 to 55 is still normal. Okay. So I have a 54-year-old today who sent me a message like, I'm still having periods. Am I okay? I'm like, yes, you're getting close to where we need to do a workup. But if you're 54 and a half and you haven't, stopped your periods yet, you're still in the range of normal. Perimenopausal symptoms, when the ovaries start shutting down, start decreasing their production, takes 7 to 10 years. It's a decline over time, but it bounces around. So it's not a steady state decline. It's like a ping pong ball jumping up and down. But when you average it out, it's a decline. And that's why it's difficult for us to have a one-time blood test that's going to clearly diagnose this. And so if you do the math, 35 is completely reasonable. for a woman to start experiencing some of the symptoms associated with perimenopause.
Wow. And that's young.
Brain fog, so many mental health things,
Yeah.
Brain fog is a huge one we see. I just can't remember anymore. Now, we don't want to miss early onset dementia, so I start talking about family history. Like, does any of this run in your family? These things tend to be, So it is a complicated, nuanced to diagnose. And then how do you treat? My premise is nutrition first, supplement the gaps, then talk about medication.
So, okay, a couple things I want to just elaborate on that you talked about. So when you're talking about hot flashes, you mentioned that there was, obviously nutrition. And I know that's part of the Galveston diet and part of decreasing inflammation. And then you said over-the-counter meds. Is there anything over the counter that you would recommend for women that might be having hot flashes?
So there are, there's nothing that 100% of women are going to get better with, but there are some not great studies, but okay, it's worth a try. It's not going to hurt you.
Right.
Unless it might counteract the medication you're already on. There's some soy-based products like estrogen that some women have found to be helpful to get them over the edge. There is ashwagandha has been showing to have some help. And then there's something called DIM, which basically kind of changes the way your body processes the estrogens that some women find relief with. So I'm like, if you're really opposed to HRT or you're not a candidate because of whatever history you have or family history, then these are some things that you could consider. And then we start looking at non-pharmacologic options. And this is specifically for hot flashes. So clonidine, which is traditionally a blood pressure medicine, has been shown to be helpful. My kind of go-to for my breast cancer patients has been Neurontin, which is an older medicine. Which treats chronic pain, it treats phantom limb pain, restless leg syndrome. It's pretty good for depression in some patients, but it also can decrease the severity and the frequency of hot flashes. So I use a lot of Neurontin for patients who absolutely cannot, are not candidates for estrogen.
Okay. Yeah, that's really helpful. So at least, just to give an idea for listeners who might be experiencing it, like
in the quiz, the emails you get after the perimenopause quiz, I go through all of this so that they can go to the doctor with a handout and say, I want to try this.
Yeah, see, that is amazing. And what an amazing resource. So that is really good to know. If you take the quiz, that you'll get all of that information. And then, okay, so the way I understand it, there's perimenopause that can last for, let's just, say roughly 10 years. Then there's like a day in your life that you're in menopause because it's the day a year after your last menstrual period. And then are you technically postmenopausal?
Yes. So, it's all semantics and how, what's in a name. And so perimenopause, medically is defined as the beginning of the decrease of function of your ovaries that will eventually lead to complete cessation of hormone production from your ovaries. Done. Okay. So menopause is the day a year after your period stop. Okay. Or when the doctor runs a blood test and says, yep. Da, da, da. And then after that, you're postmenopausal, meaning your ovaries are never going to wake up. They are a sleeping beauty. No kiss is going to make them ever produce estrogen again. And now this is where we are heading with our lives. And so what I start the conversation, what I do a lot on social media is talking about, here are the increasing risk of health that are associated with perimenopause. And I mean, increasing heart disease, increasing risk of stroke, increasing visceral fat, increasing risk of cancer. And all of this starts in perimenopause. And we know that women who are good candidates and choose HRT in perimenopause have better medical long-term outcomes than women who don't. And then definitely less visceral fat. Okay.
And so the blood test that you're speaking of, that is like the one blood test to tell if you're in menopause, what is that blood test?
So we do, we check an estrogen level, usually estradiol.
Okay.
Which in postmenopause is low, is very, very, very low, if not zero. Okay.
Yeah.
And we also check an FSH, follicular stimulating hormone, and that is produced in the brain, and it is what drives a signal to the ovaries to produce more estrogen. So your brain is constantly checking your blood for different hormone levels, and when they're low, it sends signals to the organs, to the pancreas, to the liver, to the wherever these hormones are produced, to the ovaries or the testes. Make more. We're running low. Okay. And so in postmenopause, the FSH is really high because it's like, we have no estrogen in our blood. We need more. We need more. It's never going to stop doing that.
Okay.
And Your ovaries are like dead. They're not,
right.
estrogen is low and your FSH is high. Okay.
Got it. That
in perimenopause, it just depends on what day of the month it is. And that's why in perimenopause, you can feel completely like you've lost your mind for a month.
Yeah.
And then you're like, what was all that about? I feel great. Because things, your hormones, you get a little burst and then it backs off for a little bit and the hypothalamus makes more stuff and your liver gets involved and it's binding up things. I mean, it's just a very, very complicated dance in perimenopause. And things are bouncing all over the place. And so, God, just letting a woman know this is going to happen.
Right. I mean, nobody told me this.
Like, treated. Like, no one told me. You're like, am I crazy? Why did I just yell at my kids? Like, why am I swelling? What the hell? I cannot lose weight no matter what I do. Everything I did in the past isn't working anymore. And why am I not sleeping? And no one is talking about it. And so what people want to hear from me is, you're not crazy. This is happening. And here's some things you can talk to your doctor about.
Yeah. Yeah. And I think that's really what it's all about. I mean, it's all about setting expectations, right? And, all you hear is it like, oh yeah, menopause. Oh, there's hot flashes. And until I was in it, I was like, holy, like crap. Nobody told me it was going to be like this. Like, and then like when you think of a hot flash, you think like, oh, okay, you're going to get hot and you're going to move on. But you don't realize how much it affects your sleep, your just ability to focus throughout the day. I mean, it's just on and on and on. How much and how many symptoms that sort of, it's like this trickle down effect that no one really talks about. And I think that was the biggest thing for me. And to your point, it was like a roller coaster. Like I'd feel it for a couple months and then it would go away. And I'd feel it for a couple months and it would go away. Now I'm totally in it. And it makes me wonder. So like your estrogen production is gone. Like you said, estrogen is such a huge anti-inflammatory. So now when our bodies are not producing estrogen anymore, should we just be a little bit more cognizant when we feel other symptoms? Are there things that we can do to like supplement? I know there's hormone replacement therapy that works for some people, but if your estrogen levels are gone forever and you're 50 years old, what do you do?
So, HRT is definitely a thing that you can consider, but again, not for everyone. It scares people or they just want to go natural. Whatever their thought process is, I support that 100%. You need to maximize your nutrition because it can make your body work more efficiently with what you've got. Okay. And so cannot people like, well, give me something natural to make my estrogen levels rise. I'm like, that's not happening. They're gone.
Okay. So that's clear now. Now we know. Like that is.
You are the more fat tissue you have, you can actually aromatize some of your circulating androgens into estrogen, which is why, women who are heavier actually tend to have a little bit less menopausal symptoms because they have more fat. And so, but that's a double-edged sword. That has its own issues.
Right,
so I'm not suggesting gain more peripheral fat so that your symptoms are better, but that's a long story. So there are definitely things like omega-3 fatty acids, foods rich in omega-3 fatty acids, because the minute I start talking about a specific nutrient, everybody wants a brand recommendation for a supplement. And that is not what I mean. I'm talking about you finding these foods through nutrition, through your diet, through changes. And there is so much misinformation and fads and crazy diets out there that if your only focus is to lose weight, I got a million options for you if that's all you care about. Okay.
Right.
Galveston Diet is a lifestyle and it's not a quick weight loss program. We're not here to get you into a dress to look good for a revenge wedding or something like that. I can point you to Weight Watchers or something where but weight loss at any cost comes with a cost. And it's usually muscle. You're losing muscle mass to make the scale go lower. And that leads to massive problems as we get older. And number two, you are causing such massive amounts of inflammation from the crazy stuff that you are restricting out of your diet and into your diet that we were never meant to eat in such large volumes and we were never meant to avoid as a species. And I'm talking about fruits and vegetables, telling someone that they can't have fruit.
Yeah. Right.
To me, it just is insane. I mean, it is
because it's a sugar
nutrients, And so like in our program, we talk a lot about one of the things to lower visceral fat to improve your health is to watch your added sugars. So since you said sugars, and when you lower those inflammation levels, your menopausal symptoms will get better. Okay. So added sugars are the sugars that are added in cooking and processing and also in processed carbohydrates, not whole grains, not legumes, not fruits, and not veggies.
Right.
When you avoid those to simply sacrifice sugar, then you are cutting out so many important things that are part of our healthy nutritional profile. Legumes are packed with fiber. We have got to have fiber. And that's the other thing. Less than 25 grams of sugar per day and more than 25 grams. It's on my rule of 25, more than 25 grams of fiber per day through food, not supplements.
Right.
If I had 2 bits of advice to give your followers, those 2 things. It's April of 2021. The FDA now requires packaging to show added sugars.
Oh, great.
I was just getting a whole video series ready about that. And I had bought like Gatorade and a bunch of sports drinks and things. A soda, 20-ounce Coca-Cola or Pepsi or whatever your poison is, has 60 grams of added sugar.
It's unbelievable.
Or your fountain drink, the American Heart Association and the WHO both recommend less than 25. One even is 19 for women. So, and when you're wiping that all out with one brownie, these are the things we need to watch, not fruit. You can't compare the two. Yeah.
And, quite honestly, that's not easy to do in, the lifestyle that we live today that, especially if you're, a busy mom and you're running around or you're working and you're grabbing food on the go. So it really does come down to starting with nutrition, but that is, recognizing that it's not easy. It's not going to be a quick fix. It's going to be something that you have to work on and do every single day. Right. And it's a process, right? Like you said, it's not a quick fix weight loss. It's lifelong wellness is really what it is.
And it's, small changes add up over time. When you can easily get overwhelmed. Like our program is a lot of science. I feel like I just educate. And some people just get overwhelmed. I'm like, we're just going to take this one change at a time. Let's work on fiber. Let's make that our first. Let's work on, just track the fiber. And people don't love to track. I'm like, okay, so when you go to a financial counselor because you're in debt, the first thing they do is take away your credit cards and they have you use cash to pay your bills, to do whatever. It's not because they're punishing you or credit cards are bad. It's because you have lost sight of where the money's going.
Right.
Because it's just easy. Okay. Think of me as a financial advisor. I'm a nutritional advisor. Okay.
Right.
I'm taking away, when I'm making you track what you eat and pay attention to the nutrition, it's like I'm taking away your credit card. Your I'm just going to eat this and I'll be fine. It says low fat. It says healthy. It says whatever. I'm like, no. You decide if it's healthy.
Right.
Not the manufacturing company. They don't care about your health. 100%.
Right.
And so by tracking your nutrition, it's like spending cash. You're aware. You're like, oh my God, I have so many people that come back to me after a week of tracking. I'm like, I don't care what you eat this week, just track. And they're like,
right.
I'm eating like a truck driver. I thought I was eating healthy. I'm like, well, that's why we're here. So let's look at this. Like, what's an easy choice that we can make this week in your life,
And I think that's a really valid point to make, because a lot of times, listen, we can walk the aisles of Whole Foods and Trader Joe's and get a lot of packaged food that is quote unquote good for us. And when you really look at the labels, especially if you're eating more of it than you should, then it's not so good for you. And so to your point, the manufacturers, yes, even though it might be a healthier option, it may not be healthy for you, or it may not be healthy in the quantity that you're eating it. So really sort of being your own advocate and making sure that you know what it is that you're eating is really important in that process. So do you think, I'm sorry. I was going to say, so do you think that so obviously the diet, a lot of people are focused on, okay, well, the Galveston diet, it's for weight loss. And obviously it's for menopausal weight loss specifically. But do you think that it helps with the other menopausal symptoms as well?
I've not done a study. I'm a physician first and foremost. I'm a scientist. So all I have is anecdotal evidence, meaning I have testimonials from our
Right.
students and from
Right.
and yeah, I mean, they are reporting, they take their quiz again and their score is going down. And so,
Yeah.
and we know this, nutrition can reverse a lot of these, reverse or help or lessen some of the severity of these things, because the nutritional choices you were making before, maybe even unbeknownst to you, were actually contributing to this as well. So is it at all a cure-all for everyone? No. But I have thousands of people who've come back to me and been like, I feel better. I feel
Yeah.
better. Now, I am a walking example. I went the nutrition route. It worked pretty well for a while, but then my symptoms, my loss of sleep was so severe. I looked at my family history, had a long discussion with my physician, even though I am a doctor, and decided that I'm a good candidate and I'm going to go for it. And I am on HRT.
Yeah. Great. That's awesome. And
No
it's
problem.
helped.
My sleep. I sleep. I was not sleeping before. So, and for that alone, and my hot flashes, those were the two things that I saw.
Yeah. Yeah. That's amazing. And I think that's really important. Again, just being an advocate for yourself, talking to your physician about it. So, okay. So we talked about hot flashes, the palpitations, diminishing mental health, aches and pains, hair loss. That's another one, right? Do you see that with a lot of your clients and patients?
A lot. And so that, hair loss is a multifactorial thing. And so people can lose hair because of nutritional deficiencies, autoimmune disease, infections in their scalp. But definitely because the activity of our androgens rise in perimenopause and menopause, meaning DHT, which is dihydrotestosterone, is converted. We have testosterone in our bodies normally, naturally, and some people, for probably dubious reasons, take extra testosterone with health claims that have never been proven, but I'm not going to go there right now. And so they start noticing massive hair loss. And so DHT is what in a man causes male pattern baldness. It binds to the hair receptor and it basically kills the follicle. And so if, we talk a lot about that. So there's things that you can do to block the binding of DHT to the receptor. There's medications for that. Vanica is one. There's things you can do to improve the health of the scalp, like, laser, PRP injections, et cetera. And there's things that you can put on your scalp that will stimulate hair growth, like minoxidil. And so there are things that we definitely can reverse if it's a deficiency or something, some of the vitamins, minerals, et cetera, and nutritional support. But the hormone issue, we can't stop the fact that we're in menopause. It's just not going to happen. I definitely talk to people who are taking exogenous testosterone. Would they consider coming off of it to see if their hair growth improves? And it's, such a psychological factor for so many women who lose hair. I mean, it rocks their world. And so I just kind of go through the litany of everything and then often refer them to a dermatologist to make sure we're not missing another cause.
Yeah.
Especially if minoxidil doesn't seem to be working for them.
Yeah. Yeah. I mean, it is just, the list goes on and on. So
one that I do want to mention and that no one talks about is vaginal dryness. So,
yes.
In menopause, our blood flow to the urogenital area diminishes. Okay. And the tissue of our vagina, the tissue of the urethra, the tissue of the vulva, of the labia minora and majora all have tremendous estrogen receptors. And when they're not filled, the tissue begins to shrivel and become thinner and much more likely to be injured from intercourse, injured from infection. You're way more likely to get a UTI when you're perimenopausal and menopausal than you were because of the lack of estrogen. And women and intercourse can become very painful. Like one of the reasons women are struggling with less sexual feelings is it freaking hurts. Right. And so when I'm going there with a patient and trying to help her figure out what's going on, she's on my libido. I go, well, is it painful? She's like, yes. I go, that's not your libido. That's menopause.
Yeah. Like that's called a human response.
Something when it hurts, right. No matter how much your partner begs. And so that's the first thing. And that is so easily treatable. That is a vaginal estrogen problem. We put vaginal estrogen back where you need it. It's like putting cortisone on a rash, and there's zero increased cancer risk with topical estrogen versus systemic.
Oh, wow. That's awesome.
Oh, yeah. Zero. Even with breast cancer, we are putting women on vaginal estrogen. And so it's a tiny amount right where they need it. And the tissue bounces back, thickens up, mucus starts being produced. Your UTI, It is a FDA approved treatment for recurrent UTIs and perimenopause and menopause is vaginal estrogen. That's
wow.
how it works. And so I just you have to say it. You have to ask. And
Yeah, that's crazy that like, why don't we know about that? I mean, and I'm saying that because I you know,
rooftops on TikTok, anyone who will listen, if it hurts.
Is there a brand name for it? Or is there a brand name for the?
There's multiple types. You can do a ring, a pill. There's rings, there's pills, there's creams.
Got it.
And you have to kind of look at your insurance, see which one is the cheapest covered. To me, the easiest is the ring because it's 3 months at a time. You just throw it up there and it does its job. Pills can get lost. They're kind of hard. They're tiny and you have to, and then the cream, it can be messy, but look, it's all worth it. I'm telling you.
Yeah.
Not suffer.
And like we said, like it has to be fixed, right? It's not like you want to keep living. It's not like, it lasts 2 weeks. Like this is forever. And so like these symptoms need to be fixed.
And hopefully it's a choice for you and not a mandatory part of your marriage that you didn't agree to. Then that's the other thing that happens on social media is everybody talks about that, is that it is something that must be continued until sexual activity is taken off the table.
Right. And then the other thing, I will say the one suggestion my physician gave me that I did work because I do think it's a good lubrication. And I know I've seen you on TikTok talk about it as well, is the Uber Lube.
Yes.
It's a
several lubricant options. I don't KY, plain KY. No. It's water-based, but it dries, it evaporates, and it'll make it more sticky and more painful. And so Uber Lube, there's a few. KY makes a product called Silk E, which is vitamin E based. That's more of an emollient. It lasts a longer time, and these as we age, our partners age, it takes them longer. You're kind of like sitting here, hurry up,
Yeah.
And so, it's hurting. It didn't hurt at first, and now it's hurting because of friction. And so Uber Lube lasts a really long time, as well as the Silk E. Other people have reached out on social and told me they're using coconut oil with great results. There's several options. Crisco, don't shoot me, but works great. It's a vegetable.
Oh my
oil.
gosh.
So, as long as everybody washes up after and it's fine. And so even with estrogen, I tell them, insist on a lubricant. Do not let anyone come near you without lubrication ever. Even if you're using estrogen.
Listen, we have gotten so many amazing tips from you today. And let me tell you, I'm running out to get that ring. I'm getting one. So thank you so much for being here and for sharing all of this wealth of information with us. It is information that we so desperately need to know. And as sad as it is, it's really just the tip of the iceberg. So, for all of you listeners who might be experiencing perimenopausal or menopausal symptoms and you want to know more, I would highly suggest that you head to the galvestondiet.com and take that quiz because, all we can do is really advocate for ourselves and learn more about our bodies and what's happening to us because we're in this for the long haul, right? So it's time that we sort of just really focus on us, make ourselves feel good and, not be embarrassed about it. And ask the right questions. So
this is treatable. There's so many options for you.
Absolutely. So Mary Claire, your TikTok is the Galveston Diet, correct?
Right. Uh-huh.
Yes. Awesome. So
Correct.
Make sure to follow Mary Claire on TikTok. She's awesome. And you can find her on the galvestondiet.com. And, make sure you tell us what you think of this episode. Subscribe, rate, and review it because we would love to hear from you. And until then, we'll see you on the next episode of Suburban Warrior Podcast. Thanks so much.